Welcome to the lung page. Today we are going to see chest X-ray challenge number 23. So this is a history. 65-year-old lady end-stage renal failure patient on hemodialysis via neckline presented with sudden onset of shortness of breath. So after this presentation we took a chest X-ray at the emergency ward. So we all know end-stage renal failure patient on dialysis there are a lot of causes of shortness of breath. So we took a chest X-ray. So this is a chest X-ray. So how can we interpret this chest X-ray? How can we come to the conclusion for our diagnosis, our differential diagnosis, our suspicion? As we all know, we have to read the chest X-ray with ABCD order. Airway, you can see airway is normal. Here you can see this airways are calcified. So you can clearly see this trachea and right bronchus and left bronchus, right? And you see all the bones are normal, and see cardiac contour is normal, cardiac size is normal, diaphragm normal, there's no pleural effusion, and you can see here the neckline is there, perm cath is there, and you can see the F. You can see here this lung field and this lung field. Compared to this lung field, here this left side lung field is very dark and very hyperlucency, right? So when you look very clearly, so first initially we thought this pneumothorax, but this is not a pneumothorax, right? So you can clearly see the lung mark here, but it's very hyperlucency. So what are the causes for this very hyperlucency of this chest X-ray? First, our differential diagnosis for this type of chest X-ray is this patient's pulmonary artery sometimes cut off. So when we come across this type of chest X-ray, you can see here this is little bit grayish, like here is very dark black. So it's indicate that here some blood is cut off, or sometimes the patient is rotated, or sometimes very emphysematous bullous lesion. So it's not like emphyema, not here is not emphysema is not there. So it's a hemodialysis patient on this permanent catheter. So very highly suspicious pulmonary embolism is the first our differential diagnosis. So when you come across this type of chest X-ray at the ETU, your first differential diagnosis is pulmonary embolism. So this is called Westermark sign or focal hyperlucency, that is indicate most likely pulmonary embolism, right? So these are key teaching points. Westermark signs is specific to the pulmonary embolism, but it is insensitive, right? So when you see the less than 10 percentage of the acute pulmonary cases, pulmonary embolism cases, you can develop this type of Westermark sign. So when the chest X-ray is normal, that is not exclude the pulmonary embolism. So we have to do the CT pulmonary angiogram. When according to the history, we have to come to the diagnosis of pulmonary embolism. Now you are very clear about this chest X-ray. When you come across this type of chest X-ray, this is called Westermark sign. Almost always remember one of the most important life-threatening differential diagnosis, pulmonary embolism. So we have to exclude with the CT pulmonary angiogram. I think now you people are very clear about this chest X-ray. We'll see the another interesting challenge. Bye.